Hi everyone, welcome to the channel of Medipath. Today's topic is the Whipple's disease. What is the Whipple's disease? Whipple's disease is a chronic infection which causing the multi-organ disease which caused by the Tropoma bipli. Trophirema bipli is the gram-positive, non-acid-fast and pass-positive rod which is ubiquitous, which infect the middle-aged men most commonly. The Whipple disease most common symptom is the arthralgia. This is present to the more than 80% of patient. This is the first symptom of a patient also, which is present in the early in the disease as the joint pain. But GI symptoms occurs after the lag of 6 years, which is weight loss, diarrhea, and abdomen pain. It means patient infected by the Tropoma bipli firstly present to you is only the joint pains. After 6 years, you will find out the patient also has the malabsorption syndrome, which is present as the weight loss, diarrhea, and abdomen pain, and other any growth retardations. So you have to think that the patient earliest symptom is the joint pain. After that, the GI symptoms, and after that, the CNS involvement also can occur, like the psychiatric manifestation, like the dementia, encephalitis, like the cardiac involvement can also occur, endocarditis, pericarditis, and myocarditis. So in Whipple's disease, the multi-organs are affected. But firstly, the joint involvement, joint pain is the first and earliest symptoms. After 6 year lags, there is GI symptoms like malabsorption syndromes. After that, CNS involvement, cardiac involvement, RC. This is more severe things than the joint pain. So how will make a diagnosis? If the patient comes to only the arthralgia, the making a diagnosis of the Whipple disease is very, very difficult. If the patient comes to you with the GI manifestations and joint pain, you can think that this can be a Whipple disease, and you will go for the most important thing is the endoscopy with biopsy. On biopsy, you can on HE stain you can see there are macrophages which filled with the Trophirema bipli, which is positive for PAS and positive for the immunohistochemistry. But the making it for diagnosis, you also can use the PCR on the tissue, which can be used for the diagnosis of the Tropoma bipli. But the blood stream is not useful for the PCR technique, because the tissue has the most importantly the Trophirema bipli, which can be extracted by the PCR and always helpful to making the diagnosis of the Trophirema bipli a Whipple's disease. So after the making a diagnosis by the endoscopy and biopsy by PCR and the HE or PAS stain, you have to go for the treatment. Treatment is initial phase and maintenance phase. Initial phase, you use the tetracycline penicillin antibiotic. On maintenance phase for 1 year, you use the trimethorphan and sulfamethoxazole. So antibiotic is recommended, but the antibiotic of choice, optimal regimen is still uncertain. But we use in the initial phase 2 to 4 weeks is the tetracycline and penicillin G. For maintenance phase for 1 year, we use the trimethorphan and sulfamethoxazole. After you treat a patient of Whipple's disease, sometimes after years the patient can relapse. For most of the time when patient relapse, they come with the CNS manifestations. So you have to you have to treat aggressively the patient of the relapse. Okay, so this is all about the Whipple's disease. But when you see a HE stain, or PAS stain, these look like this. There is many macrophages filled with the PAS positive, granule positive Trophirema bipli. So this is the PAS positive, granule positive macrophages, because there is a glycoprotein which present on the wall of the Trophirema bipli, which is positive for the PAS, and immunohistochemistry always positive for the Trophirema bipli. They are always negative for GNS stain and GMS stain, because GNS stain is positive for the TB and the GMS stain positive for the fungal infection. So these macrophages which granule positive for the PAS stain, this is the characteristic finding on the biopsy, histopathology, for making a diagnosis of the Whipple's disease. After making a diagnosis, we can use the antibiotic, the ceftriaxone penicillin G or trimethorphan sulfamethoxazole. We can use this all about the Whipple's disease.